You may be seated. Good evening, everyone. My name is Dr. Stephanie Blanco. I'm the Director of Clinical Education for the Speech Language Pathology Program. We're so happy to welcome you here today for the white coat ceremony of the class of 2027. Yeah. It's my honor to welcome here the graduate students, the faculty, the dean, the vice dean, family, friends, all of you to welcome to join this special occasion. To start, I would like to invite our department chair and division chief, Dr. Vikas Grover, to say a few words.
Good evening and welcome. Thank you for joining us this evening to celebrate this wonderful event with us. I was told that this white coat ceremony starts today at 5:30 p.m. and ends at 7. And I completely disagree with that. We'll see why. Neil Walsh had said, life begins at the end of your comfort zone. For tonight, let's adapt it to white coat begins at the end of your comfort zone. Right? So the question is, did the white coat ceremony really begin today at 5:30 p.m.? As I said, we think it began much earlier than today. You stepped out of your comfort zone when you decided to choose speech language pathology as your career. You stepped out of your comfort zone when you completed your prereqs and learned the complexities of communication. We all know how complex communication can be. You stepped out of your comfort zone when you came to the first class feeling a little uncomfortable, yet excited for your new journey. And you guys know, the first class was with me, so I remember how it was. When you realized you might need to redesign your learning patterns from undergrad education to learn new clinical applications. You stepped out of your comfort zone when you sat in the class and thought, this is difficult. When you completed your weekly quizzes and exams with or without remediation, right? You know it. When you received feedback from your professors and clinical educators asking you to change things. That was all you coming out of your comfort zone. When you were in therapy and evaluation sessions with clients with severe challenges and looked to your clinical educators for the next step. Socrates once said, we were taught to memorize answers, but not to question questions. The real journey of white coat started when you began questioning questions and using critical thinking, starting from phonetics. We all know what white coat generally symbolizes. Symbolizes professionalism, symbolizes responsibility, and symbolizes commitment. But what are the building blocks for those things to happen? The first building block I want to talk about is humanness. This fast-paced world, checklists, templates, various objective evaluations, standardized scores, raw scores, scale scores. You guys are used to that. However, humanness helps us remember that we are working with a person first and the challenge later. So the root of humanness is state of being a human. If we forget who the person is we are dealing with, all our objective measures remain objective to the condition, but not to the human. So we want to keep that in mind. Then comes compassion. The root is to suffer with or a fellow feeling. When we say fellow feeling or to suffer with, it is the deeper level of understanding that goes beyond just saying, oh, this client is dealing with this. It requires compassion to understand what they might be going through and what they might be feeling at that time, and understanding or allowing them the space. Only then comes the word service. When can we serve or help others? When we understand their real needs. And that happens when we listen. Real listening happens when we listen to understand, not listen to answer. Listen to answer also happens later, but first is listen to understand. So when you think of service, think of listening to the need first. Hence the act of serving or helping. Like all my classes, I never end my lecture without giving a critical thinking question. So here is it for you now, critical thinking questions. Nobody else except the class getting the white coat is allowed to answer. You can help them. So these are some words there. Your task is to sequence them correctly and tell me what will go in number 1, 2, 3, 4, 5, and 6. That's not a real test. I'm just asking you to consider it. Don't answer, right? But you know what the point here is. Sequences change. There is no set pattern sometimes in what we do because it all depends on humanness and communication. It's not a straight line that anyone and everyone can decide to have. So, white coat ceremony. Am I okay saying this? Not 5:30 to 7 p.m. It started a long time ago and is going to be a lifelong process. This is the time to remind ourselves of the path we are already on. How can we do that without saying an important thanks to our support systems? And immediate support system is behind you and in front of you. So a round of applause for people who are sitting behind you and people who are sitting in front of you. With that, many congratulations, and today will be the night to celebrate. Thank you.
Thank you, Dr. Grover. I'd like to now invite Rabbi Fogel for the invocation.
Ribon Kol Ha'olamim, Master of the world, bless all those who have assembled here today. Take part in the white coat ceremony for the speech language pathology program of the School of Health Science and Practice here at New York Medical College, class of 2027. Almighty God, healer of all flesh and wondrous in your acts, you have instructed and empowered humanity to provide comfort and aid to all your children. And before you today sit talented women and men ready to shoulder your directive to help and heal the world. We pray to give strength, courage, and fortitude to these women and men who now prepare to leave their training and begin their mission of healing. Bless them as they set out as your agents, serve those in need in their communities where their care, compassion, and service are sorely needed. Grant them the wisdom and the strength to help all those who will benefit from their care and therapy, and the ability to uplift those in need and despair, and above all, we pray you imbue these women and men with the highest standard of ethics, which are at the core of their mission and training. The white coat not only signifies a transition to patient interaction, it's a signal to yourself and to the world and to all those around you that you are on the front line. You are out there. You're out of your comfort zone. You have dedicated yourself and your careers to help, heal, and nurture others. Your white coat is a symbol of trust and responsibility, and we pray that as you receive this symbol today, the meaning of the coat will inform and enlighten your decisions from this moment onwards. At this auspicious occasion, we also pray to your dear God that you shower your blessings upon our students and all of their loved ones, parents, spouses, siblings, children, mentor, and other dear ones who have been there for support and encouragement, who have helped our students reach this milestone, who have sacrificed so much so that our students can persevere and succeed. And we humbly ask that you bless the administration, the faculty, the staff of the New York Medical College School of Health Science and Practice, dedicated men and women who strive to impart knowledge, achieve excellence, and lead by example. Grant them the wisdom, the resolve, the fortitude to continue their noble mission of educating the next generation of healers and caregivers who will be exemplary in their caring. Touro University and New York Medical College, as a core mission, was created to serve, strengthen, and improve your world, dear God. And we ask for your continued divine guidance so that we together achieve that great potential. Amen.
I'd like to now play a few words from our Chancellor and CEO, Dr. Edward Halprin.
Good afternoon. My name is Edward Halprin. I'm the Chancellor and CEO of New York Medical College. I'm sorry I cannot join you in person. I have a meeting with the chairman of the Academic Affairs Committee of the Board of Trustees, and no one has figured out how to be two places at once. But I am glad I can reach you through technology. The standard white coat speech is to congratulate everyone for having caught the ring on the merry-go-round of life. Hurrah, you're going to be speech-language pathologists. A promising career awaits you. Good for you. Good for New York Medical College. Isn't it all wonderful? That would be the standard speech, but I think instead we ought to talk about a very serious matter, which is speech-language pathology and the problem of evil and how you're going to deal with it. For example, I am a pediatric radiation oncologist. I take care of children with cancer. I was recently consulted in the case of a teenager with metastatic cancer of the prostate. Now, people are accustomed to hearing about cancer of the prostate. It tends to occur in older men, and it is an adenocarcinoma. It is usually localized and highly treatable and often curable. How do teenagers get this cancer? Well, actually, they don't. They get a different type of tumor which can arise in the prostate. It's called rhabdomyosarcoma. And in this case, the tumor metastasized from the prostate to the lymph nodes of the pelvis. These swollen malignant lymph nodes have encased the nerves emerging from the sacrum and are causing severe pain. And the radiation therapy that is being requested would be for amelioration of pain. The case raises two profound questions. One is scientific, the other is theological, philosophical. The scientific questions are, why did this child get cancer and what are we going to do about it? The philosophical and theological questions are, why did this child get cancer in a philosophical or theological sense, and what are we going to do about it? Well, let's break them down. Why do children get cancer? They get cancer for one of the classic carcinogenesis causes, either from spontaneous mutation or chemical carcinogenesis, viral carcinogenesis, radiation carcinogenesis, or hormonal carcinogenesis. In this case, it's likely from a combination of tumor-promoting oncogenes and growth-inhibiting suppressor genes going awry, causing a spontaneous mutation and causing cancer. What are we going to do about it? We're going to treat in order to relieve pain and reduce suffering and try to get the child stabilized to go on to a chemotherapy protocol. Now, in a philosophical, theological sense, why does a child get cancer? This is called by philosophers the Epicurean paradox, after the Greek philosopher Epicurus. Epicurus writes several thousand years ago, if there is an all-powerful, all-merciful, all-knowing God who rules human affairs, then why do terrible things happen? Why are there earthquakes? Why are there floods? Why are there tsunamis? Why do children get cancer? You can't blame it on the child smoking or drinking or being obese. They didn't do any bad behaviors. It just happened. Why do bad things befall the innocent? Is it that God's not all powerful, not all merciful, not all knowing, or not all that interested? Epicurus poses this paradox, and philosophers have spent thousands of years grappling with it, including in the book of Job. Now, I wish I could be the world's greatest chancellor and tell you I have a solution to the problem of evil. But as speech pathologist, you're going to be engaging with the problem of evil all the time. Why can't this baby swallow? Why is this child stuttering? Why does this stroke patient not have the ability to swallow? And how are we going to get him out of the ICU? This person has suffered terrible physical trauma from an automobile accident or an airplane crash, and they have difficulties with speech and with swallowing. What are we going to do about it? In all of these cases, evil has befallen the innocent, and the speech pathologist is called upon to do something about it. And you cry out to the heavens and say, why did evil befall the innocent? And the response you get back is silence. Silence. So what is the thinking person to do? Well, one philosopher, theologian, Joseph Soloveitchik, said, when faced with the problem of evil, you can call out to the heavens and ask why, but the only response you're going to get back is silence. Therefore, the only proper action for a thinking person is action. Do something about it. Similarly, in chapter 14, verse 15 of the book of Exodus, there is the story of the Israelites escaping from slavery in Egypt, and they're going to cross the Red Sea, and the waters of the Red Sea part. You've seen all that in Cecil B. DeMille's movie with Charlton Heston, The 10 Commandments. Actually, what the text says is the people cried out, and they cried out to Moses, and they said they were going to cry out to God, and God responds, tell the people to move. Sometimes translated as tell the people to get moving. The interpretive story that goes with it said that the waters of the Red Sea didn't actually part until the people started wading into the waters. The point of it is it's an answer the same as Soloveitchik. If you stand around wringing your hands and crying out to the heavens, that's not an effective strategy for the most part. You have to do something about it. And that, my young speech language pathologist, is my message to you as you don the white coat. The response to evil in the world is action, and evil which impairs articulate speech and swallowing requires action. And as you don the white coat, you will do battle with the forces of evil by taking action. And to that end, to that long line of women and men in white coats stretching backward and forward in time, who have devoted their lives to the relief of pain, the amelioration of suffering, and to helping people to the extent possible avoid premature death. I wish you all Godspeed on this next part of your journey in becoming speech language pathologists. Thanks for allowing me to join you, albeit by video. Have a good afternoon.
Thank you to Dr. Halperin. I'd now like to introduce our Dean of the School of Health Sciences and Practice and Vice President for Government Affairs, Dr. Robert Amler.
Thank you. Good afternoon, everybody, and congratulations to you, but also the people sitting behind you, family, friends, loved ones. Thank you all for being here this afternoon with our graduates as they don their white coats and walk ahead into the future. Thank you all for being here, and graduates, let's show our enthusiasm and appreciation. Dr. Halperin just expressed his point of view that the white coat is a call to action. I love that. I have a somewhat different story to tell, but it's quite complementary. Think about this. I'm going back to the first time I put this white coat on. Now, my mother would be upset if it was the same white coat
It's not. It's a clean one. So let's make sure about that. 50 years ago, next month, I put this white coat on for the first time as a young MD graduate. And I had that kind of reaction that Dr. Halpern experienced. I thought, oh man, I'm really hot stuff now. I'm a doctor, I'm a healer, I'm noble, I'm wearing a white coat that tells everybody I'm great, and my parents are proud, my family is proud, my classmates from college are jealous, and this is just great. And boy, was I wrong. You have all been with patients now. You know what the real story is. People are sick. They need our help. They're in pain. They can't even speak, some of them. Some of them can speak, and all they can say is nonsense type syllables. They are truly afflicted, and they are here for your help. And that's where the white coat stands out. Not that the wearer is so great, but that the wearer of that coat means something to the person who is suffering. The coat is clean. It's nice. It means the person wearing it is competent. And you can be confident as they are confident, or at least reaching for some confidence that they can help you. This person is compassionate. This person wearing the white coat is dependable, faithful to the principles that dictate evidence-based treatment for the problem they're facing. I think most importantly is you see that white coat and you feel, I can trust this person. I can trust them to make a difference for me. And you know they'll try. Some will be more effective, some will be less effective. It depends what you come to them with. It also depends on how confident and competent they are. But that's the equation going into it. They're going to do what they can to the best of their ability because they're wearing this white coat. Now, in today's world, we don't all wear this white coat every day, do we? In fact, some therapists don't have to wear them at all, really. But it is symbolic of what they contribute to the world and to their profession and to the people they help. It's the symbolism of the coat, not that the fact the coat, in this case this afternoon, happens to be clean, which I'm very proud of. So 50 years later, my message to you is savor this moment. Going back at New York Medical College to 1860, 166 years ago, a long time. A long line of healers, health professionals, therapists, physicians, and now even dentists, going back to all seek the same thing, the professional competence that makes them clean and nice and dependable and trustworthy. And think of the long line going into the future of the hopeful people who will fill these seats 2 years from now after you've graduated. Excuse me, a year and a half. No, more like a year, right? But in 2 years, there's going to be a whole new group of people sitting here, and they are going to be hopeful as well to go forward. And 10 years from now, 20 years from now, I might not make it to that particular ceremony. That's okay. That's okay. The fact is, you've started, continued, and you've carried on this tradition of great competence and great trustworthiness in treating people. Finally, the first speaker this evening talked about getting out of our comfort zone. Well, he's right. We all did that, including yours truly, a long time ago. Doesn't it seem like a long time ago when you were just applying to a program or programs like this? But the fact is, you've mastered that comfort zone already for quite some time, not just the year that you've been with us, but with the years leading up to that time. or from your earliest days getting interested in science and helping people who need help. So continue that new comfort zone that is bolstered by your sense of being clean, being confident, being competent, and all of those other C words that seem to work very well for a white coat ceremony speech. I'll just end by saying that I truly, truly hope that you will think back with pleasure on the time that you're spending with us here now, and the time that you spent with us this past year, and the evening that we were all together as you put on your white coats for the very first time. Thank you, God bless, and let's show them what we can do in the name of New York Medical College and the people who brought us to this point. Thank you.
Thank you, Dean Amler. I'd like to also thank our Vice Dean of School Health Sciences and Practice, Dr. Ben Johnson. You could stand if we can thank you for being here and taking pictures for us. So thank you so much, Dr. Johnson. Yeah, we'll see. We'll see how they look. All right. I am so grateful to introduce our invited speaker, Ms. Michelle DiMattia. Ms. Michelle DiMattia is the Director of Speech Language Pathology, Hearing and Speech Center at Weill Cornell Medicine. She received her Master's of Arts in Communication Disorders from the University of Minnesota and her Bachelor of Arts degree from the College of the Holy Cross in Worcester, Massachusetts. She holds the CCC SLP from ASHA, as well as certification from the American Board of Swallowing and Swallowing Disorders. She's been a clinical instructor for over 25 years in multiple hospital settings, training staff and graduate students in MBS swallow studies and dysphagia assessment and intervention. In addition, she has supported several hospitals in training clinicians in the assessment and treatment of premature infants in the NICU, as well as neonatal and pediatric video fluoroscopy. Her clinical practice includes the evaluation and intervention of dysphagia and feeding disorders in infants, children, and adults. She's made many important contributions, but I want to specifically highlight her work as the SLP supervisor at Westchester Medical Center. In that role, she was instrumental in securing and organizing student placements, developing structured placement models, and providing strong, consistent support to students throughout their clinical training. She also supervised our students during modified barium swallow studies, offering valuable hands-on experiences. It's been our pleasure to work with her over the years, and we are grateful that she continues to return to connect with us and our students. Thank you. Ms. Michelle DiMattia.
Hello, everybody. I'm about to take my glasses off, so it's an experiment. I'm not going to be able to see the page as well, but you see me doing this a lot. That's because I wanted to make sure that I got all my talking points. Actually, I think I'm going to keep them on. We'll see how it goes. And I just want to say that some of the themes I'm going to touch on the next few minutes are actually themes that have been mentioned in the previous speakers' speeches. And I think that the reason why we keep coming back to them is because they're really important. So some of the points that I'm going to touch on are underscoring some of the things that have already been said, but in my own way. So to the faculty, families, mentors, and most importantly, our speech language pathologists, almost our graduate students, congratulations. Today marks an important transition. This white coat that you're wearing represents entry into clinical care and into a different type of responsibility and relationship with patients who will trust you with something deeply personal. Their ability to eat and to communicate and to be heard and to be understood. And up to this point, your training has been largely academic. You've practiced skills in controlled settings, and that foundation matters, but it's just a starting point. A little bit of chaos awaits you. Yeah, let that one sink in just for a second. You're on the threshold of environments that are fast-paced and complex and often unpredictable. You'll meet patients whose needs don't fit neatly into a textbook case, and you'll encounter ambiguity, and you're going to make decisions without feeling fully ready. And that's not a flaw in your training. That's just the nature of clinical work. So no matter what you do over the next year, it's not whether you know everything, it's how you approach what you don't know. In the next few minutes, I'm going to ask all of us to keep 4 thoughts in mind on how to move through this next life chapter for all of you. Hands-on clinical learning is often messy, it's confusing, and it's born out of mistakes that are made and how you change as a result of those mistakes. So these 4 thoughts are ones that I tell myself every day, multiple times a day. And we're all walking this road together. Every clinician that's in this room is standing on the shoulders of giants, and you are now too. So here's my first thought. Being human is very important. And I'm an emotional person, and I'm going to cry. Because what we do is really important. The patient in front of you is a person who has fears just like you. They have needs just like you. And they want to be seen and understood just like you. That's where this comes off. And while your job is to understand their diagnosis, you really should not separate them from their experience. The patient who seems non-compliant is probably exhausted or confused and definitely afraid. The parent who asks the same question 3 times is not trying to be difficult. They're just trying to understand what it means for their child. And this speaks to the very best part of our profession. This field is deeply, deeply human. We get to spend extra time that our physicians rely on us to spend with our patients. We're not just treating communication impairments or voice disorders or swallowing disorders. We work with people who are scared or grieving changes in their identity or grieving the loss of function in their child. And the depth of that grief is impossible to understand and sometimes impossible for them to bear. And our job is to bear witness to that. So being human, for you to be human, just like this, and to remember the humanity in others is really important. Next, curiosity is really important. Students and seasoned clinicians who grow most readily and most expansively are the ones who are willing to say, I'm not sure, can you help me understand that better? Or, I think I heard you say X, Y, and Z. Did I get that right? Using this script over and over again in all kinds of scenarios with your patients and your colleagues puts you in a position of seeking to understand and minimizes the tendency to think that we all know the answer. And oh, by the way, it really works with your friends and your life partners as well. So you're welcome. Just try it. It'll work. Promise. I learned this strategy from a physician colleague named Elvira Paravancini at NYP Columbia on the palliative care team in the NICU. And if any of you know what palliative care is, you would understand that that feels like a contradiction to have a palliative care team for neonates. But over and over again, I watched this woman counsel families who had decided to give birth to infants whose life diagnosis was incompatible with longevity. So, such as trisomy 13 or a variety of other diagnoses. And some of our patients live for days or months, and some of them only live for minutes. And collaborating with her was a rewarding and life-challenging experience. But despite being a leader in her field, thank you, with a tremendous amount of knowledge, she never presumed to know her patients more than what her families knew. And she would always say, my babies and my patients are my teachers. And now I say that too. And the next thought I have is that serving others, again, echoing what Dr. Grover said, serving others is really important. Healthcare is meant to be in service to others. One of the strategies I use frequently when I'm not crying is to squat down below eye level for my patients to physically demonstrate to them that I'm not talking down to them, that in that moment, they're actually looking down on me, and therefore they have more power and control over that situation than they realize. This happened just recently, a couple weeks ago, in aerodigestive clinic, where we had to help a family struggle to understand, who was struggling to understand. We had to let them know that a G tube was needed or a gastrostomy tube was needed for their child. And that this family was struggling with the idea that this child couldn't eat by mouth right away. So I bent down in a suit and heels, and I got on my knees and I took this mother's hand, and I reminded her that I worked for her, not the other way around, and that we were going to figure it out together after we secured a safe means of nutrition for her child. And the mother broke down crying, and she admitted that she felt really overwhelmed by that moment, and she was grateful that the whole care team felt that way. And afterwards, the pulmonologist, because it's a pulmonology, GI, ENT, and speech that are all part of our aerodigestive team, and as we were walking out, he said to me that it was a very meaningful thing to be reminded that we don't say that type of thing often enough to our patients. So I'm challenging all of you to remember that you are in service to others. And lastly, accountability. It's really, really important. You're now part of a care team when you start your externships. Patients are impacted by our preparation and our attention and our follow-through. So show up ready and be on time. And do a very thorough chart review, even if you don't understand what you're reading. Ask questions. Small habits matter. Being prepared for the mechanics of your externship by walking in with your checklist of tasks, the data that you need to collect, the goals that you're setting for your session, all of that will free you up to be more observant in the moment. And it will free you up to watch and observe how your colleagues and your supervisors are interacting with those patients, what they're doing to connect with families and nurses and physicians, what they're doing to build trust with their patients. So being prepared allows us to notice how to explain complex information simply. And these are the skills that hands-on externships are meant to foster. And that's going to define the kind of clinician you become and what you choose to pay attention to. Because attention, real, deliberate attention, isn't automatic. It's a skill and it's a choice. So today, this white coat that you're wearing, it represents a commitment to remember our humanity and the humanity of our patients, to stay curious and to be of service and to be accountable. Confidence does not come before competence. Competence comes from repeatedly showing up and improving over time. So if you feel unsure at the beginning, that's okay, because that's exactly where you should be. And that's where the magic happens, and where the necessary friction of learning firsthand begins. That's the work. So congratulations on your success so far, and welcome to the next chapter. Thank you.
Thank you, Michelle. I'd like to now introduce alumnus Ms. Nicole Scafora from our Speech Language Pathology class of 2018. Ms. Nicole Scafora, pediatric NICU speech language pathologist at Mount Sinai, is an alumni of our program, a highly skilled clinician specializing in neonatal feeding and swallowing. She's provided meaningful supervision and mentorship to our students, offering valuable hands-on experience in the NICU and guiding them through complex clinical care. She also contributes to the community through educational presentations and by sharing valuable information to support SLPs, families, and caregivers. Nicole?
I don't know how I'm going to follow up after Michelle, but I'm going to try. Good evening, everyone. I stand here today as a proud alumni of New York Medical College. I earned my master's degree here in speech language pathology in 2018. And I always say that I truly believe that all my professional endeavors after graduate school were largely attributed to the academics and clinical opportunities I had here. It's very exciting and humbling to stand in front of you all today to congratulate the group of first-year students transitioning into their second year. It's also a privilege to speak in front of my prior professors and mentors whom I looked up to during my time here. The switch from first year to second year is a big transition for you all that comes with more responsibility and exciting opportunities. I'm glad it's now being recognized as a white coat ceremony to honor that change, and that you're one step closer to becoming a speech language pathologist. In your first year of graduate school, you are learning the ropes of the most effective ways to study and to stay organized. You're introduced to working with patients and interacting with their families. You are learning which areas of this vast field appealed to you and where you could picture yourself in the future. Now you'll be making the transition to full-time externships while also balancing academic work. This comes with the new responsibilities and challenges, such as commuting to your sites, adjusting to new styles of writing, balancing clinical demands with academic tests, applying your knowledge from the classroom to real-world scenarios, and making clinical decisions in the moment. Some unexpected challenges that you might have are communicating with caregivers and other disciplines, being the one to provide difficult information to your patients in challenging times, receiving feedback from a supervisor and trying to apply it immediately, as well as asking yourself if you're in a setting that you could picture yourself in the future. As someone who went through this program and had 4 clinical placements, I understand what you all are going through. I remember having full days of externships, coming home and preparing for a full day, up to 10 hours of classes back to back. My classmates and I used to switch seats between classes just to break up time spending in the whole classroom. For clinic, I remember being really excited to finally get the hands-on experience that I really wanted, but it was challenging. When I came here to New York Medical College tonight and I passed by Westchester Medical Center, I remembered living on campus and I still got to my placement 1 hour early because I knew that chart reviewing was something that was really hard for me to do. I also remember telling my supervisor that I had to take a bathroom break, and that's when I used to have to tell myself, like, okay, I know what I'm doing, I can do this. Now that I'm a practicing clinician and I regularly take students of my own, I would like to share some advice with you. First is to be open to every experience that is given to you. You might surprise yourself by a setting that you never thought of yourself in. I entered New York Medical College as a determined student who was fixed on working with adults in an acute care hospital. I graduated with a clinical fellowship in early intervention, and that exposed me to working with medically fragile pediatrics. Now I stand in front of you all as a pediatric speech language pathologist who works in a children's hospital and in the NICU. My second piece of advice is to take advantage of the supervision you are receiving and the feedback that they provide to you. You never know where life will take you or what changes in settings that you want to pursue in the future. That rotation might be the only time that you have in that setting until you're in a working experience. Your supervisor isn't trying to make you do their job, but instead wants to make sure that you're as prepared for that setting as possible during those short amount of weeks that you have there. Next, make positive connections with your supervisor. The speech community is small, and you always want to leave a good impression on others. Lastly, approach classes as information that you can take with you throughout life and through your externships, and not just for an exam. If you can't remember all these pieces of advice, along with the others that came before me today, come back to your intention for pursuing this career and your drive for being in this field. We all, I suspect, have this underlying passion to help others and to make a difference in this world. A profession where we can enhance communication and swallowing disorders is one we are privileged to be in. Congratulations to the class of 2027 and completing your first year at New York Medical College. The best is yet to come.
It's beautiful. Thank you, Nicole. Okay, we're about to move forward with the donning of the white coats. Before we do that, I just wanted to acknowledge our speech language pathology faculty who's here in the front row. So you can stand and face everyone, Dr. Gitti Leiner, Professor Katie Ballerini, Dr. Wendy Georgian, Professor Hannah Tahan Jackson, and Dr. Vikas Grover. We're grateful for the academic and clinical support they provide, so thank you. Okay, I'm going to ask the first row to please stand up and line up. And I'm going to invite Professor Katie Ballerini to get in her spot and Dr. Vikas Grover to get in his middle spot over here. Matthew Ancona. Carla Barahona. Yanya Batista. Rebecca Berry. Samantha Betterton. Allison Brown. Jenna Calvo. Bridget Chacha. Eloisa Collins. Danielle Frasco. Maxwell Geary. Lindsay Drazy. Nicole Hoffman. Danielle Idice. And I now have Dr. Wendy Georgian come to the front. And the next row can line up. Yoki Kong. Julianne Masonette. Lauren Melendrez. Rachel Miller. Alexandra Montez. Kelly Olmsted. Laura Pollock. Olivia Portanova. Lisbeth Rodriguez. Isabella Roman. Jordan Tucker. Nora Tui. Emma Vance. Abigail Virgo. Abby, you take your time. You got all the time in the world. Yes. Good. Congratulations to the class of 2027. Can we have the first row of students please stand and face your families? And the second row, please stand and face your families. Everyone can remain standing. Thank you. I'd like to invite Dr. Wendy Georgian to come up for the pledge. Students, you can remain standing and face the screen. We also ask that the faculty stand.
As I enter the profession of speech-language pathology, I respectfully and willingly pledge the following. As I enter the profession of speech-language pathology, I respectfully and willingly pledge the following. I will commit myself to the ethical, responsible, and diligent practice of speech-language pathology. I will commit myself to the ethical, responsible, and diligent practice of speech-language pathology. I will respect and uphold the laws and regulations that govern my profession, adhere to its ethical principles, and accept the profession's self-imposed standards. I will respect and uphold the laws and regulations that govern my profession, adhere to its ethical principles, and accept the profession's self-imposed standards. I will faithfully honor the inherent dignity of all and treat those who depend on my help with respect, consideration, and appreciation for our diversities. I will hold paramount the welfare of persons I serve, as well as those who are participants in research and scholarly activities. I will always protect the rights and confidentiality of those who seek my help and act only for their benefit. I will continually strive to learn, further my professional competence, accurately share my knowledge with those who seek it, and advocate for the unmet communication and swallowing needs of the public. I will always conduct myself with dignity, maintain collaborative and harmonious interprofessional relationships, and place service to humankind before personal or material gain. With honor and pride, I commit myself to the profession of speech-language pathology. Congratulations, everyone. You guys did great.
Thank you to everyone for attending this special ceremony today. As we conclude, I'd like to make some final acknowledgements. Please join me in a round of applause we have Kara from Public Relations taking pictures today along with Dr. Johnson. Thank you. Michael Cotter and the audiovisual team, specifically we have Juan and Michael here for their contributions to the success of the ceremony and the assistance they're providing. To Dr. Halpern, Dr. Amler, Dr. Johnson, and the Dean's Office for their support of our speech-language pathology program. Thank you. A thank you to the Division of SLP's dedicated faculty, clinical educators, and administrative staff for their unwavering support and dedication to the students' academic and clinical success. To Dr. Grover and our coordinator, Katrina Martinez, for their efforts in making this ceremony happen. Thank you so much for that. For all of you, family and friends who have offered and continue to offer such crucial support to our students, thank you. And finally, to the class of 2027, for all your hard work and dedication. It's a pleasure to see how far you've already come, and we look forward to seeing what happens from here. Congratulations.
And not to forget, a big round of applause for Dr. Stephanie Blanco.
Okay, thanks. Okay, well, on that note, I'm blushing. This concludes our white coat ceremony. We ask that students remain here. We can take a group picture. Family and friends, you're welcome to exit at your leisure, take pictures, and we'd love to meet you. Thank you for being here. Take care.